Well, I want to welcome back to the show our fellow Middlesex County Commissioner Shanti Narra. Before we had the Commissioner Director Ron Rios on before talking about a little bit about COVID, but before we came on the air, I was talking with the Commissioner, and it seems like whenever now the officials, whether we're at the local level or at the county level, the main topic of discussion, not just here but nationally, is about COVID. Whether it's trying to protect yourself or when is the vaccination coming, about tests. So without further ado, Commissioner, COVID's the first thing out of the gate before we talk to anything else. So take it away with what your thoughts about where the county's going with all this.
Well, let me just start off by saying that I am incredibly proud of everybody in our department, which is the Department of Public Safety and Health. And they have been working nonstop since the pandemic hit. And this is a group of individuals. When we went full lockdown starting in March, I just have to say, at the county, we took everybody's safety seriously. So there were departments all over who went into lockdown and who were working remotely. And anywhere we could have county employees work remotely, we did that. But because of this pandemic, it just turned out most of the people in the departments who work under public safety and health couldn't do that. And so they have been out in the offices, in the field. These are the people who put together the testing sites for the whole first half, from March all the way until probably about a month ago. The 100% focus was on testing, right? How do we make testing widely and safely available to the residents in a way that's efficient, right? And that has been a task that I think that they rose to incredibly. We've had testing sites throughout the county, and we've been lucky. One of the things Middlesex County residents have been lucky is because we're the home of Rutgers. The spit test was invented here, and we were lucky enough to be able to put that out and have spit testing done at many of our sites as a protocol to introduce it for usage around the country. So I'm just going to say all of that as an intro. They have been doing yeoman's work. And so pretty much for the last month and a half, they've been putting into place protocols that we've all been working on since the summer in anticipation of a vaccine, and not really thinking that we would get the vaccines as soon as we did. It's been amazing to be able to have viable vaccines, but clearly now the issue is, how do we get those shots into people's arms, right? And so the state, as most people know, has 6 mega sites that they opened. We've been lucky that Edison, the Raritan Center in Edison, is one of those 6 state mega sites. I was out there, I think it's almost 2 weeks ago, on the date that it opened. The governor came on that date, and I was there with many of the other electeds throughout Middlesex, and I toured the facility. And it is being exceptionally well run. It's being manned by National Guard troops. There are various organizations and Robert Wood Johnson and everyone else is out there staffing it, as well as the county supplementing staffing. And but the issue is, we can have mega centers and we can have what we're doing in Middlesex, which is to have county hub sites. We have the capacity and we will be able to, at a moment's notice, open up 6 locations throughout the county. We have not opened up all 6 for the pure fact that we don't have enough vaccine. And at the point that we do have enough vaccine, I want to reassure anybody listening in Piscataway or throughout the county, we can get the site up at a moment's notice. We have all the protocols and policies in place. We are working right now on making sure that we have enough staff. One of the pieces of having a vaccine is also having enough people who know how to administer vaccines, right? We need enough medical professionals, whether they are doctors, pharmacists, nurses, who have been trained and who are licensed to be able to give these vaccines. It's not something that I can show up for and say I'm willing to volunteer. I'll go give people shots. That's not something we can do. So we are busy creating a volunteer corps, and a lot of people throughout the county have stepped up and are willing to volunteer. East Brunswick opened up. We opened up a site in East Brunswick just the other day, and East Brunswick Mayor Brad Cohen happens to be a physician. And so he was there that first day, volunteering time to give shots. And it's people like Mayor Cohen and colleagues of his in the medical profession, the nursing profession, pharmacy. I've had a number of pharmacists call me, retired pharmacists, saying that they are more than happy to volunteer their time. And so we're working on getting that coordinated. And some people are asking, well, what's the problem? New Jersey, we're a hub. We have 1 million medical professionals in New Jersey, right? That's what it seems. But there are issues because you have to have liability coverage, right? And I know me saying that, and I'm a lawyer, you're going to think, of course, right? Of course, lawyers are always worried about that. But we have to be concerned to make sure that anybody who is volunteering has the proper licensing, and then we cover the liability. And we just know that everything's being done in the safest possible way for any resident coming to get a shot. So that's like the setup. And, we've been giving vaccines in Sayreville at the Fire Academy. We have been doing it in Piscataway on certain days. Obviously, about that, Mayor. The East Brunswick site, Monroe Senior Center, has been a location. But we're looking forward to the day. We're hoping to open up a site at the Heldridge in New Brunswick, has graciously offered to be a vaccine site for us. I think our plans are to have a day out there, I think probably sometime next week. And we also have plans when we get to a point where we get a full amount of dosages to also have mobile capability. We've had mobile units that we have put into use for the testing. And there have been sites throughout the county. One of the things we were doing was going out to fire stations and setting up a mobile testing site. So our first responders had an easy way to get tested. They've been out there working, and of course they don't want to expose their families or anyone else in their circle. So to have easy, accessible testing has been something that's been a great concern, and we've been trying to respond. We can also convert those mobile testing sites to mobile vaccination sites at a point where everything is fully everything is fully operational. So we can get to other communities that may not have one of our 6 hubs. So there are many towns that, people would have to go from, like, maybe say North Brunswick to New Brunswick or Piscataway or whatever, but we're going to have availability with the mobile units to get out to some of the towns like Jamesburg.
Well, I want to say, Commissioner, one thing I think the residents in Middlesex County and Piscataway have to appreciate, the fact that we've had potential other mobile and or satellite sites here in town. If you were living out in the Western Plains, like say the state of Montana, where you only have a hospital that's like maybe 200 or 300 miles away from you, I don't think people realize how lucky we are that where we live, that once we do get the supply to do the, vaccinations, it'll go pretty fast, I would think, once that happens.
And look, not long term, but the ideal goal is at a point where New Jersey is getting enough vaccines to meet the needs in the state. I know one of the plans is to have vaccines available at the pharmacies. And that will make it even easier for people to be able to go to their local pharmacy and get the vaccine. So all of this is in stages, right? And we are ready, willing, and able to to deal with the next stage, sufficient vaccine to be able to operate 6 local hubs and then soon after that, the mobile units. And I have to say, because I'm getting a lot, the county actually is getting a lot of calls and emails and texts. I'm getting a lot, but now my fellow commissioners are also starting to hear because there've been certainly the process by which you get registered to be able to get an appointment for a shot has been difficult. And I know there's been a lot of, frustration on the part of the public because you go on the website that the state has, and the website has not been 100% functional on every day. So I've been hearing stories about people, on that website for days trying to get an appointment or getting kicked off. And all I can say is believe me, the state's aware of the problems, and they are working around the clock to get that website at an optimal functional point. And we're concerned, just like everybody else. We've been in daily conversations. People may not know, but the county has been in daily conversations with the state every single day since this crisis started. There are Zoom conferences, and they go over the
And
different
you and I both been on part of many of those.
Yes. And so it's not a lack of awareness. People know what the problems are, and they're working really hard. But I have to ask people to have patience, because the magnitude of these operations, and when you think about opening up a portal, a web portal, and saying to people, register here, and the hundreds of thousands of hits that portal is getting, and when it's not a simple process, coordinating the information too, it's going to take a little while to clean out the bugs from the system. And what you mentioned before about the accessibility of vaccine, I'm not trying to tell people, listen, other states have it worse, so have patience. I'm just saying you have to acknowledge, right, that there are many places that are having troubles of various kinds. And with the density of our population, this was never going to be an easy, operation, but we are working on it. And the one thing I've been telling people is, 4 months ago, maybe it's 4 months ago, we never thought we'd be in a position where we would be vaccinating anybody, in early part of 2021. Literally, if everybody thinks back, the viability of a vaccine only became clear, I think, in December. And so this has been amazing that we have 2 vaccines, and there's the potential for a couple more. The Johnson & Johnson one is around the corner. I know I've already gotten emails and some calls, because I think a lot of people in the general public were a little concerned because the efficacy of the Johnson & Johnson vaccine is at, I think, 66, 67%. And that's not as high as Moderna and Pfizer. So I don't know how that all works out. I mean, they haven't finished the process with the federal government to get emergency use authorization. But there are drugs, vaccines coming through the pipeline, and I think we can be hopeful. I think AstraZeneca has another one that they're out of the UK. So I think that there's a lot of hope that people should be, it's okay to hope, because I think things are on a positive trend.
Well, I know, take it in Piscataway itself, we're very fortunate because we've had the Rutgers Medical School housed out of our town. We had the original testing site for the county, now another inoculation site when it's ready to go up and running. So we're fortunate here in Piscataway. Once the supplies come, we have there is a site ready to go in conjunction with the County Board of Health. One of the things one of the questions that a couple people rose up, why is Piscataway Township the health department's the primary thing? Because we've had an interlocal agreement with the county Board of Commissioners for more than a decade to handle our health services. And then when you have a pandemic like this, obviously you want to have between the 25 towns in the county, you want to have some uniformity, because when there's only finite amount of vaccines to go around, you want to make sure whoever needs the high priority list gets done first, and then you work your way down the pecking order. But that's a way of to manage this pandemic. Could you imagine if there was 25 towns going in 25 different directions in a situation like it's sort of like what the former president did. He told all 50 states governors, you folks figure it out. The federal government's out of it. You really have to wonder governmentally at the national level, had the president at the time invoked the Defense Act for procurement of these products, because a lot of people don't realize it's just not about the vaccine itself. You're talking 600 million syringes, pads, alcohol pads, and tape, everything else that goes along when you go to, say, get a booster shot at your primary care facility. So it's just not the actual vaccine itself. So there's a lot to go about there, and it's a shame, because I really think had they not fumbled the ball back in April of last year, we would have had all the ancillary supplies ready to go for when they would have had the vaccination to go.
I couldn't agree with you more. And this is not like, this is not about politics. This is about just operations. I will tell you, one of the clearest examples of that is, as you mentioned, the syringes. So a lot has been made in the press. It's been coming out in the media that when, like Moderna's vaccine, when they sent it out packaged as 5 doses in a syringe. And it came out that a lot of the medical professionals were saying, wait a second, we can get a 6th dose out of this syringe. Well, people didn't understand what that meant, and a lot of people are still confused. But the key issue there is if you have the appropriate needle to go into that vial, that vial of 5 shots, if you have the right syringe needle, you can get a 6th shot. If you have the wrong size syringe needle, you can't get a 6th shot. And so right now, the administration is, I believe they did use the Defense Production Act for this.
Yeah, President Biden just authorized that. So
yeah, but they are going into mass production to get the right syringe needle top. And so then you find places like New Jersey or Middlesex County, and we are now trying to source those because we want to maximize the dosages that we can give out. And I'll tell you, to just go back for a second, when the pandemic first started, from a county perspective, watching our people on the phone, on the computer, reaching out not only in New Jersey, but all over the country and abroad in these crazy conversations to try to get enough masks, to try to get enough protective gear, PPE for, the people who have to do the work, first responders, public health officials, everybody, to try to get that so that we could protect the frontline people here, was unnecessary to put people through that, right? It was just crazy. It was a feeding frenzy. It was people, fighting each other. There have been stories in the press about things that happened in California, and it led to not in Middlesex. We were very lucky, and our work paid off. But around the country and even in other parts of New Jersey, it's led to situations where there was fraud. There were situations where people didn't get their deliveries. There were a lot of things, and it was, to my mind, incredibly unnecessary if there had been a cohesive national plan.
And I absolutely agree with you 100%. I know when this first out, we were able to procure enough masks for all the employees of the municipal government and Board of Education, as well as their family members, because if you didn't take care of the family members, the first responders and everybody that worked for the town, you don't want them getting infected either, because all you had to do is have 1 or 2 employees go off in a division or a police department shift, and then the next thing you know, you have about 10 police officers down for 2 weeks.
Right.
So it was a very challenge at the local level and for the county level too. And people have to realize that a lot of these first responders and people through the health department, working through the county and the municipal government, they have families too. And during this pandemic currently going on, they still have to watch out for the welfare of their own families as watching doing their primary jobs in order to protect the residents of Middlesex County. And I think there's a sort of a disconnect right now with some residents because in general, they're just worried about their own immediate family, which I totally get. But if you don't have the first responders being taken care of first, then you're not going to get to the next step because that's the bottom line.
Absolutely. I mean, when we're talking about these sites, and I'm telling you the enormous amount of personnel we're going to have at these sites, right? We have to make sure they're safe, right? It does no good to have them exposed or them not having the right equipment. And let me tell you this, when I say this about all the right equipment, and people aren't aware, and I really want people to understand, if I'm vaccinated and I have my second shot, and I've the 2-shot vaccination, that protects me from the COVID-19 infection. But that does not mean that I cannot still carry it and thereby infect someone else, right? Me having the vaccine means COVID-19 is not going to make me sick, right? If the vaccine works the way it's supposed to, but I can still be a carrier. So when people enter the vaccine sites, they're going to still see people masked up with PPE and everything else because it's necessary. Clearly we're going to make sure that they have their dosages, right, before they administer people. But that still doesn't mean that we also want to protect anyone else who may come in, who may be escorting people in. It's a process where I know a lot of people think, as soon as I get the vaccine, I won't have to wear the masks anymore, right? I'll be fine. I'll go back to doing all my normal activity. And unfortunately, that is not the case. Because if you have the vaccine, if you interact with someone who hasn't had it, there's still a chance you might pass it along to them.
And there's a total lot of unknowns. One last thing, we have about a minute to go before we let the commissioner go. I want to publicly thank a lot of the businesses in Piscataway and in Middlesex County who had the personal protection gear that donated it to either county or the municipal governments around the county. And I know we ended up with one of the large distribution centers that just moved in, donated enough face shields for all of our employees. And you can't be thankful enough. I know there's always some critics out there that don't like economic development or businesses coming in, but this is one case where this is a situation where the first responders have benefited from that happening. And it's all hands on deck, both at the governmental level and at the private sector level, in order to try to protect everybody. And that people have to understand we're all part of the same universe.
You know what? I'm so glad you said that, Mayor, because there's a mattress company in one of our other Middlesex County towns, and partway through the pandemic, the owner of that mattress company, he converted some of his operations to making masks. Yeah. And he also provided a lot to local facilities. And so this is what I'm talking about. People just sitting there saying, I'm in business, I'm going to work my business, but I'm also going to be a good community member. And if we had not had those kinds of partners, we would be much worse off. So I'm really glad that you mentioned that.
Well, and I want to close out in thinking that, like in Piscataway, they just opened up a company that can make up to 90 million N95 masks a month.
I heard.
That's pretty impressive. So I want to thank Commissioner Santinari for stopping by on Piscataway, and also the Commissioner Director, Ron Rios. And we will be hearing more from them throughout the year, and we want everybody to stay safe. Good luck and stay safe, Commissioner.
Absolutely. Goodbye, Piscataway.
Yeah.
Nice to be here.